In the wake of the opioid crisis, talk about PTSD, depression, suicide, there are several opportunities to find a place for help, but maybe going someplace is not right for you. Please welcome Jamie Vink. She's the CEO of Sierra Tucson Group, and she's here to talk about an exciting new program that just launched at Sierra Tucson. We're very excited, but first I want to know, what is Sierra Tucson? What do you do for patients?
Well, Susan, thank you for allowing me to be here to talk about Sierra Tucson. And Sierra Tucson, until most recently, has been a residential treatment center. We are one of the originals. We've been providing services for 36 years, and we're in the Catalina Mountains, and we are a place where people come. They spend approximately 30 days with us, and they work on their substance use disorder, their depression, their trauma, whatever it is that's going on for them.
And most of these people stay there at the facility, but just this month you all have launched a world-renowned new way of looking at treatment, and it's an outpatient type of care. What is the difference here?
So in our residential program, people actually come in and they stay with us 24 hours a day, 7 days a week. So they step out of their lives, if you will, away from their families, away from their professions, and they live with us. What we have found is that what we wanted to do, it's been a dream of ours, to take those residential services, our integrated model of care, treating the whole person, mind, body, and spirit, and allow someone to do it on an outpatient basis.
So someone watching may feel like, okay, well, maybe I'm not a good candidate. So give us an example of an outpatient care scenario.
Absolutely. So in an outpatient care scenario, one would come to treatment with us. They would drive there, and they would be there from 9 o'clock until 2 o'clock in the afternoon. Someone that would be ideal for that would be, let's say, someone that's always been a social drinker, that's enjoyed a couple of drinks maybe 3 times a week, and then something happened in their life, some sort of transitional moment, be it a death in the family, a child moving away, those kinds of things, and they find that perhaps those 2 drinks is becoming 3, and their own behavior is worrying them. Perhaps they're in individual therapy and they're finding that it's just not enough support to get from one session to the next, so they would truly benefit from that group environment where they would come and share with other like-minded individuals and avail themselves of all the integrative services such as body works, equine psychotherapy, all of the things that we know have worked for 36 years on the residential side of things.
Wow, that is incredible. And again, that's perfect for folks who have small children at home.
Absolutely.
Who still need to live a normal life, and you still, of course, get to receive this incredible world-class treatment. Why now?
Well, as we know, we're in the midst of an opioid crisis and also a suicide epidemic. And what we're finding is that there's so many people reaching out to us for support that have lost a loved one to suicide. Do you know that 250,000 people a year become survivors of suicide, and every time someone dies by suicide, 3 to 5 individuals are impacted. So the time is perfect for us to offer this support to the community when talk therapy just isn't enough.
That's wonderful. The ripple effect is so huge. Thank you so much. This just opened earlier this month, so please take advantage. Thank you so much, Jamie.
Thank you.
Sierra Tucson is located at 39580 South Lago del Oro Parkway. That is in Tucson. To book an appointment today, please call 1-800-624-9001 or visit sierratucson.com.